Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. With me today is NFID Medical Director Dr. William Schaffner to answer our questions about celebrating the holidays during the COVID-19 pandemic. Public health authorities are now advising people to stay home and skip the usual festivities. Meanwhile, we're hearing promising news about new vaccines, and even the most cautious among us are growing wary of COVID-19 restrictions and are eager to find a reason to celebrate. Can we do so safely, Bill?
Well, we can do things to reduce the risk, but as you know, Marla, I don't like to use the word safe because it sounds absolutely safe. We're all about reducing the risk. And if we're careful, we can do that while we wait for the vaccines. But even when we get the vaccines, we'll still have to be careful.
Perfect. So, Bill, how are you and your family planning to celebrate the holidays this year?
Well, Thanksgiving is just passed, and that's our model. It was very reduced in our household. We usually have a large dining room table with many family members in attendance, but we were our intimate little family group of 3 this year. It was all very small, and then we did a lot of Facebook and telephoning, and that worked out just fine. We were being very careful this year. We didn't want to have this virus being spread while we were giving thanks. And so we put everything down. We closed it down. This is the COVID year. We should all be flexible and be willing to change that we're doing in the hopes and expectations that next year will be much better. And we hope by this time next year, close to near normal again.
Absolutely. And so recognizing that really nothing is completely risk-free, are there other steps that our listeners can take to mitigate their own risks for themselves and their loved ones during the season?
Well, there are lots of things, and we'll start out with the standards, right? When you leave home and you start interacting with people, wear your masks, be watchful of social distancing. It's the group activities that give us difficulty. All that traditional shopping and going out in crowds, the special religious services, the office parties, all of those things, the recommendations are to avoid them, frankly, to do them virtually every time you can in order to avoid those crowds. That's exactly the circumstance. Prolonged exposure close to other people in enclosed spaces that this virus likes to be transmitted and will do so very readily under those circumstances. And so everything we can do to avoid those circumstances reduces the risk, and of course, the risk to others also.
So, Bill, presuming that some will still wish to travel during the holidays, are there some modes of travel that are safer or less risky than others? And in general, are shorter distances less risky than longer ones?
Well, let's start with the mode of travel. If you travel by car, you and a couple of family members, that's your own bubble. You can control that environment. You can take food with you and drink, or you can just get it through pass-through. You can run in and out of restrooms wearing your mask and doing a lot of good hand hygiene. And if you fill up the gas tank, you can take wipes along to not only wipe off your hands, but at the gas pump as well. So you can control that environment. But if you go by public conveyance, that is airplanes, buses, trains, or whatever, you lose a lot of that control. There are a lot of people who are going to be around you. They may not all be wearing masks. They will get closer to you for prolonged periods of time. And so travel by public means is going to be riskier than travel by yourself. It's not so much the distance, it's the means of travel, all the hubbub before and after, not just being on the train or the plane or the bus, but everything that happens around the travel that's more risky.
Makes perfect sense. So we hear stories that many now are relying on rapid test results to help with their own holiday planning. Does a negative test result really mean that you're free to celebrate as you wish?
Well, I certainly agree that lots of people are using testing, both before and after. And of course, testing is useful, but it has its limitations because it's a snapshot. It just tells you what your circumstances are that particular day. And be wary of which test you're using. The gold standard, of course, is that nasal swab test that's done with what's called PCR technology. Those rapid tests surely do give you rapid results, but they can be falsely negative. So no test is perfect. In particular, it only tells you what your circumstances are on that particular day. Add it to all the other things you're doing in order to prevent infection. And yes, it's useful. Relying on it completely, that could get you into trouble.
Indeed. So on a positive note, we seem to be making rapid progress on promising new vaccines. How soon can we really expect to have these COVID-19 vaccines available to the public? And once we do, does it mean that our days of mask wearing are numbered?
Nothing is quite that easy, Marla, as you and I both know. So we hope that by the end of December, at some point, a vaccine or vaccines may become available. The first people who will be prioritized for the vaccine are undoubtedly going to be healthcare providers, those who care for COVID patients, including first responders and the folks who work in nursing homes as well as in hospitals. So they'll be first in line to get the vaccine. It may also be that nursing home residents receive it. Could be. And then after that, in a gradual way, according to a prioritization scheme that will be announced, either essential workers or people age 65 and older and people with underlying illnesses, all of whom might get more severe disease, they will be online for getting the vaccine. This is going to be stretched out. We're trying to vaccinate 330 million people in the United States, and as I like to quip, we can't do that in a week and a half. So it will take months for a vaccination program to roll out. And of course, we'll have to convince everyone to come in and get their vaccinations. During this time, for the next many months, mask wearing will be the norm. We'll still have to do social distancing. We will still have to avoid groups. Now, there is light at the end of the tunnel because we think by this time next year, end of the summer, into the fall, perhaps we can get back to something that's near normal. And wouldn't that be nice? But in the meantime, we have to continue to be cautious. And when the time comes, let's all line up and get that vaccine when it's our turn.
Couldn't agree more. Bill, thanks again, as always, for this really helpful perspective to help people have a safe or at least less risky holiday celebrations. We appreciate your time and look forward to talking again soon. Thanks.
While we all celebrate, let's all be safe together.